It was actually considered as a male rite of passage to have the bleeding associated with the disease seen as the male menstruation. Right.
An estimated 1 billion people, approximately 1/6 of the world's population, suffer from at least one neglected tropical disease. I recently embarked on a journey to find out more.
Schistosomiasis, you've probably never heard of it. I hadn't either, but it's actually not a laughing matter. So I've come here today to Warwick Medical School to find out more. I'm here with historian Kira Doyle, who spent the last 2 days vaguely looking at the history of Schistosomiasis to find. So you said that we have a lot of recordings from the ancient Egyptians, is that correct?
Well, we do. Obviously, a lot of them based their lives around the River Nile.
They did.
And we know that this is associated with waterborne snails, if I believe so. I'm just a historian, I don't know the science.
Okay, yeah.
So there was a lot of associated cases with this. It's kind of considered waterborne. So around the Nile, it was very rife at that time. Now, it was actually a bit of history for you.
You're the historian.
I am. It was actually the blood in the urine symptom associated with schistosomiasis was actually viewed as a male rite of passage. So it was viewed as male menstruation.
That's interesting.
Yes.
And then how did we get to our present day knowledge of the condition?
Okay, so there was a bit of time between this when a German physician noticed the urinary symptoms of schistosomiasis and he renamed it bilharzia.
Okay, interesting.
After that, we kind of skip on a bit to the 50s when there was a lot of dams and irrigation schemes to get rid of the waterborne infections, but it seemed to backfire. It seemed to create more in a few places, which was quite bad. Between the 50s and 80s, there was something called a tartar emetic injection, which was considered to get rid of the disease. However, it just increased mass spread of hepatitis C, which...
That's not good.
It's not good.
It's not what you want, no. Okay. Well, some dodgy history there from Kira, but okay, yeah, we'll leave it at that. I think thank you very much. Thanks for meeting me today, Grace. You're going to tell me a little bit about the life cycle and some of the symptoms. Is that right?
Yeah, a bit about how it infects and what symptoms it causes.
Okay.
So schistosomiasis is a waterborne parasitic worm,
Right.
and therefore it's found in areas with poor sanitation because infected individuals, their stool and urine enters this fresh water, and infected stool and urine contains parasitic eggs. These hatch in the water to give a parasitic worm that then invades snails in the water, in which it multiplies and matures. They then are released from the snails and are able to infect any humans who are bathing or swimming in that water. They infect by penetrating the skin, and then they enter the venous system and travel in the portal veins around the body. The parasitic worms mate and produce eggs, and these then migrate to the intestines and the bladder to be excreted. Not all eggs do this. Some eggs remain in tissues, and they're what cause the chronic symptoms of schistosomiasis. But the worms themselves, before they create the eggs, do not cause an immune response. So they go unnoticed for long periods of time. It's the eggs that cause the immune response. So symptoms aren't really shown for 1 to 2 months.
Okay, so it effectively has a life cycle in the snails and also in the humans.
Yeah, effectively,
Right.
yeah. And so within the humans, you can have acute or chronic presentations.
Yeah.
The acute presentations are similar to other diseases, so fever, cough, muscle aches.
Pretty non-specific.
Pretty non-specific, yeah. And these only really show after 1 to 2 months because that's when the eggs appear. But past that, chronic symptoms are when the eggs that haven't been excreted, that remain in tissues in the body, such as the liver or the kidneys, they cause an inflammatory response. So patients have abdominal swelling, cramps, and occasionally anemia or malnutrition follows with that.
Thank you, that's been really informative.
So
there's a lot of information to take in.
If you wanted to diagnose it,
Yeah.
you would have to have either a urine or a stool sample diagnosed, or you can do a blood test to test for an immunological response.
So just looking at the parasites down on what
Yeah,
is
just really
enough in the blood or
finding the parasites. Yeah.
Cool, good. Well, that answers a lot of my questions. Thank you very much for meeting me.
That's all right. Anytime for you,
There we
John.
go. There we go. You know, it's all been very interesting so far, but there's something that I haven't actually told you guys, and that's that I had a friend who was unfortunately diagnosed with schistosomiasis recently, and I'm going to go and meet him now.
When are they coming out?
Oh, Jack, it's so great to
Yeah,
see
good
you
to see
again
you.
finally after all these years. Let's go and have a little chat in this room. I just really wanted to ask you a little bit about your story with the disease and, you know, how you got it and how it felt being inflicted with this pretty awful thing.
So I was working as a whitewater raft guide.
A what?
As a whitewater.
Youth, how about it, kids? Mad child starting an army. Who wanna join it? Warriors, raise your fist if you enjoying it.
I returned to the country, and about 6 months later, I kept getting kidney infections and bleeding. And then, after a lot of tests, I eventually asked for a test for schistosomiasis.
You asked for the test?
I asked for the test, yeah, because one of my other friends had been diagnosed with it, and they gave me the blood test, and I turned out positive. So I was treated, and now we're all good.
It's lucky that you were fortunate enough to be in a situation where you could easily...
Yeah, it's good to be in the UK where the treatment's easily accessible.
NHS. So how were you treated?
So I was given a drug called praziquantel,
Right.
which is a drug that's not actually licensed in the UK for use in humans, but people normally see it if you get drontal for your dog or cat.
So it's kind of like worms.
It's a worming tablet, yeah. That's
Right.
what's the active ingredient, and it's not licensed for humans in the UK, but they can order it in specially for patients if they need to.
So what, you just basically go down to the pets at home and you just buy some anti-worming?
That'd be a little bit easier, but they can import it, especially if
Okay.
your doctor requests it, and it's a doctor who's specialised in treating that.
So how does that drug work?
Okay, so the drug, you only take it once a year.
Right.
That gets rid of the infection, and in places where the infection's quite often happening because they're getting reinfected all the time, they just take the drug once a year just to keep on top of the infection. And it basically, it paralyses the worms, like the flukes inside you, and they fall off, and then your body can attack them, like phagocytose them, or you just pass them out.
Interesting. So a pretty effective treatment if you have the means to get it.
Yeah, it's a very effective treatment.
So I've been doing some reading, a little bit about the epidemiology, where we might find this, because I hadn't heard of this disease, and it doesn't seem to be in the UK. What I can find from the internet is it seems to be associated with areas of poor sanitation around the world. So certain parts of Africa, certain parts of the Middle East, Indonesia, Cambodia, places like that. And there's a number of different species which are located throughout these different regions. So in one review of the disease burden, I think the WHO said that something like 200,000 deaths could be contributed to schistosomiasis, although direct deaths are more like 12,000 a year. Tell us a little bit about where we're going with schistosomiasis.
Okay, so as I think you learned when you were researching yourself, obviously the future of getting rid of it is clean water and sanitation, which is why it's affecting third world countries more. So we want to prevent the life cycle in humans, because at the moment we can't vaccinate it because of the life cycle of the worm. So we can't eradicate it yet. So this is something that we might think about in the future. But at the moment it is considered a neglected tropical disease. We don't have a lot behind at the moment, so that is something we're looking into. So we do have low access to treatment.
Time at Warwick Medical School was coming to a close, and I think I'd learned enough about schistosomiasis for one day. That's fucking awful. I mean, that's